So what's the agenda for today? So we'll be discussing the legacy and the new Osce. We will be discussing the difference and the similarities for those examination. Okay. We'll also be discussing the documents and the assessment tool, which are the PHQ9, news, the must, GCS, and the TPR. And also, most importantly, the marking criteria. How are you going to pass the examination? Okay, I will be giving tips along the way. So, yeah, if you're rewatching our session, good luck. If you want to see my face again, nice to see you guys, and good luck on your examination. So that's that. So before we begin, so what examination should you be taking? So if you registered before August, 2nd of August 2021, and you haven't done your English examination, that is the OET or IELTS, that means you will be doing the old OSCE. If you registered after 2nd of August 2021, that means you will be doing the new OSCE. Or alternatively, if you registered or started your application before 2nd of August 2021 and you haven't done your OET or English or your IELTS, you will be sitting the new test of competence. So please remember that. And I think the cutoff for the old test of competence is this August. The NMC will be giving us a year, 1 year of transition period for the old and to the new examination. So yeah, good luck, guys. So hopefully you'll be able to come here in the UK as soon as possible. So let's do a comparison, okay? So for the Legacy 2014, you will be given 15 minutes for your examination, okay? 15 minutes for the examination. For the new test of competence or for the new OSCE, you will be given 20 minutes because you will be performing the A3 assessment, which is a bit longer. During pandemic, I don't know if you've seen the video on my channel. The video there, the old video, it's like only for 12 minutes. Why? The reason behind that is during pandemic, we don't have any actors. And you only need to describe on how are you going to take the observation. So you will be performing the actual observation or vital signs taking, as we call it here, observation, we call it here in the UK, observation, to a real person. Okay? So actors, for the old examination of the Legacy 2014, the actors are only present during assessment. For the new test of competence, the actors are present in both assessment and implementation stations. So please do remember that. Those are the only two stations wherein you're going to interact with an actual person. So next is the pre-read. So what is this? So pre-read is for the assessment station. For the old examination, you will be given 5 minutes prior to starting the station. So what are you going to do with those 5 minutes? You have an opportunity to check or read all the documents, okay, that I will be showing later on this session. Okay, so 5 minutes. Unfortunately, during that 5 minutes, you cannot write anything at all. You are only allowed to read and write your name, and that is it. Okay, so later I will be showing what documents are those in the next coming slides. And unfortunately, for the new test of competence, the reading section is part of the 20 minutes. So once the assessor starts the clock, that is the only time you're allowed to read the documents. And for the pen, for both examinations, you will be using a green pen, okay? You've probably seen this on the videos on my YouTube channel, but the usual question is, so Emmer, do we need to buy our own pen? No. So the pens will be provided on the examination, including the fob watch, okay? The fob watch is the small watch we're using in the UK. We normally pin it on our chest, not on the chest, but on the uniform. So, and we will use it as a timer, okay? So in the UK, we have this bare below the elbow policy wherein you cannot wear your wristwatch. That's why we do use fob watch in practice. So settings. So on the examination, there are different settings. So mainly it's the hospital setting and the community setting. Because if in the UK, if they say adult nursing, you can either be working in the hospital or you can either be working in the community. And they want the examination to be inclusive. So you will all be experiencing different settings on your examination. Yeah. So community, you can be in a residential home. You could be in a nursing home. Another one is you might be in a hospice. Okay, you might be working in a community hospital on your examination. So those might be the settings on the examination. So please do prepare for that because there are kind of there are like differences and similarities in terms of the settings on the examination. Next is the PPE or the personal protective equipment. So um, why do you need to wear this? On the examination, because of COVID, um, this rule applies at this very moment. Okay, we don't know if it might be changing in the next coming weeks or months. So historically, when we do assessment station, we don't wear PPE. Okay, we don't wear PPE. But because of COVID, and you will be interacting with a real person, you will be wearing this PPEs during your examination. So that's why if you've seen the video on the A2 assessment on my YouTube channel, if you haven't watched it, please do watch it. Um, Coco, my colleague, she was wearing the gloves whilst she's doing the hand hygiene. Okay, so on the examination, the assessor will tell you, just demonstrate on how would you normally perform hand hygiene. And when I said PPE, that is the face mask, that is the gloves or the clean gloves and the apron. Okay, so those are the 3 PPEs that you will be needing or you will be wearing on your examination. So on the examination, you will be starting and ending the station with your PPE. So you will not be removing your PPE until the actor is gone. Okay, until the actor is gone. The assessor will tell you that information before you start the station. Just remember this. This might change in the next coming weeks. Assessment tools. So if you can see, these are the assessment tools that you might be needing to accomplish on your examinations. Those, what are those? It's the news chart, it's the GCS, it's the TPR, it's the must and page. We'll be discussing it later. But if you compare it into the new Osce, with the new Osce, the TPR is missing. The TPR, it doesn't reflect the A2E assessment. Okay, later you will know why. All right, later you will know why. And the other documents we'll be discussing is the assessment brief, the admission, and there you go, the discharge letter. And for the new Osce, you will be given the candidate brief, the overview of the patient history. So later we'll be talking what these documents are. So let's start with the documents first, okay? The marking criteria, we will be discussing it at the end. So what are these steps? But for now, we'll be discussing the documents. So we will start with the old Osce or the Legacy 2014. So this is the first document that you will be seeing on your Osce. So the assessment overview. So this assessment overview contains the scenario, and this document will not be marked. So let me read you an example of a scenario of examination. The one on your screen, I don't know if you could see it properly. So the instruction is complete a nursing assessment of the person. An observation chart is provided and must be completed within the station. So this scenario that I'll be reading is about heart failure. So Alex has been admitted to Whitley Ward by emergency department following an episode of shortness of breath and swollen ankles, likely due to fluid overload. Alex experiences shortness of breath that is worse when mobilizing and when lying flat. Alex's breathing has improved after she was given diuretics, but will feel occasionally breathless. Alex takes diuretics regularly at home, which interrupts her sleep at night due to frequent urination. So the instruction is, please proceed with your nursing assessment, including taking and recording vital signs, blood pressure, temperature, pulse rate, respiratory rate, saturation levels, and calculating the National Early Warning Score. So please focus on breathing and mobility. Assume it is today, and it's 7 o'clock. Alex has just arrived from ED. This document is for your use, and it's not marked by the examiner. So this document will tell you the scenario, okay? So going back to what I've said earlier, you will be given 5 minutes to read this, including the next documents, okay? So on the examination, you will be seeing the word today to represent the date, okay? Again, you will be seeing the word today to represent the date. So Emmer, can I put the word today on my papers? Yes, they will accept it, okay? Another way of practice is, once you know when your examination will be happening, on your documents, you write that date. Let's say my examination is tomorrow. So I will practice writing tomorrow's date on my papers whenever I'm practicing, okay? Or alternatively, again, you can write the word today and the test center will accept it. And in the UK, we follow the 24-hour time format, most especially if you're working in the hospital, okay? Because we don't want, we are not using the 12-hour format because sometimes it creates confusion. So if we say 1300s, that is 1 p.m., okay? So it's a 24-hour time format, or some of us might know it as the military time. So the only thing that you need to write for this document is your name, and that is it. Okay, that is it. At the back of this paper, sorry, I don't have a screenshot of the back part of this document. The back part is like a notes part wherein you could scribble. You could write your findings or you could take down notes. Again, it will not be marked. What pen you're using a green pen. The next document, which is the most important document for your assessment station, is the adult inpatient admission or discharge forms and trust score patient activities of living initial assessment. So let's spend some time in discussing this, okay? I will be giving you tips. I won't be able to show you the entirety of the document because we don't have enough time. I just summarized the one on your screen. What's the content of this document? So let's start with the patient's details. As you can see on your screen, you can see the patient's details. So what are those? The patient's full name, sex, date, address, and postcode. It contains the basic information about the patient. And this document is vital because how are you going to check that the patient, that you have the correct patient? You are going to use this document on the examination. So that's why you will be given 5 minutes to read the entire document. So this document, just so you know, you have 11 pages, okay? You have 11 pages for this document. And the one on your screen are the summary of its contents. So let's discuss it. So reason for admission, by reading this, you will know what the scenarios are. So on the examination at the moment, we have 8 scenarios. So the first scenario is we have asthma, we have pneumonia, we have hernia, we have subdural hematoma, we have fall and fracture, we have ectopic pregnancy, we have malnutrition, and we also have depression. So next is the past medical history. So the past medical history are of course, it's self-explanatory. It's the past medical history of the patient. I will give you a tip when you reach this section of the document. It will tell you what will be the medications you're about to administer on implementation station. It will give you a hint. Why? Let's say, I'll give an example. If the patient is diabetic, so probably on implementation station, which we'll be discussing in the third leg of this webinar, probably an oral hypoglycemic agent will be prescribed there, such as metformin. Okay, so that is a hint on the examination. So please do spend some time in processing the information under the past medical history. Another one, let's say the patient has depression. Probably on your implementation station, there is one medication there that will be intended for depression. Okay, so that is a tip on the examination. Next is allergy. Oh, the one on your screen, we have medication. So medication, sometimes patient will be bringing this medication. This leads me to the trap conversation. I don't know if you've heard of the traps on the examination. Number one is medication. On the examination, most especially on the old examination, you might be seeing a couple of traps or safety concerns in the examination. And number one is medication. Let's say a box of tablet, or let's say an inhaler on the patient's tablet. The most important thing or action that you will be doing is to lock the medication. Remember, it can be a safety concern. What if there is like a confused patient roaming around, let's say beside the patient, and accidentally the other patient would take it. So make sure on the examination, if there is a medication on the patient's table and you don't know what that is, make sure you lock it. Okay, make sure you lock it. That is your intervention on the examination. But make sure to explain to the patient why are you doing such thing. Next is allergy. We'll talk about it later, but I'll give you a tip. So please remember this. If the patient is allergic to any medication, remember that. That might be prescribed on the implementation station. Okay? So if the patient is allergic to medication, to anything, most especially medication, please keep an eye on that information because it might be prescribed on the implementation station. So that is your allergy. Next is smoking and alcohol harm reduction. So I think it's on the third page of this document. It will give you the information if the patient smokes or not. So if the patient is smoker, definitely you need to give the patient information about on how to quit smoking. The conversation might be giving the patient alternatives. What are the alternatives for smoking? Let's say patch, nicotine gum. So those might be your conversation in terms of smoking, and also or refer the patient to the NHS quit smoking services or the smoking cessation team. Okay, so make sure to ask for the patient's consent, because can you imagine if the patient is like smoking for the last 20 years, it's really difficult for the patient to quit smoking. So that might be your conversation in terms of smoking. And alcohol harm reduction, of course, if the patient, on this section, you will be seeing scores, okay? You will be seeing score. You will see the alcohol harm reduction scoring system. If the patient scored really high, you have to refer the patient to the alcohol liaison nurse. But then again, you have to make sure to give some health teaching in terms of alcoholism in particular. So, Emma, question, do we need to discuss everything? No. Okay? You don't have to discuss everything. Just focus on the things on the admission booklet you think that will matter most to the patient, because on the examination, they will not like provide or give a lot of drama on these items. They are just selecting sections of the admission booklet wherein you have to discuss with the patient, because definitely it's impossible for you to discuss everything within 15 minutes, okay? And social history, this section talks about carers, package of care. It talks about pre-existing services for the patient. Let's say the patient has community physiotherapist. Next is um, activities of daily living. So this one is self-explanatory. If the patient could do their laundry on their own, if they could cook, if they could prepare their own food, that information will be written in this particular section of the document. VTE risk assessment. So in the UK, as part of admission, make sure if you're the one admitting the person, make sure to check if the VTE risk assessment has been done. On this section, the only thing that is written is, if it's done, just check it. If it hasn't been done, you have to escalate it on the medical team. So do we know what VTE stands for? It's the venous thromboembolism, okay? So we have to risk assess the patient when they are admitted in the hospital. And dementia. So far, we don't have any scenario that talks about dementia. But then again, you'll never know. In the coming future, they might be including a scenario which deals with dementia. So in this section, the only information that you will be seeing is if the patient is diagnosed of dementia and what are the interventions you have to do, most especially safety. Okay? But yeah, so far we don't have any scenarios which deals with dementia. Next is communications. Communication is easy. If your patient has any problems with hearing, seeing, it's here. It's at this point. So the most important thing that you should know is, as part of the traps, on the examination, you might be seeing, where's my face? You might be seeing a pair of eyeglasses, okay? Or a hearing aid. So the most important thing that you have to perform in the examination is to offer it on the patient, okay? Offer it to the patient. Because can you imagine, what if the patient is partially blind and you are there standing in front of the patient? Definitely the communication will be not so very good, because the patient cannot see you at all. And then what if the patient is deaf? So they cannot hear you at all. Next is, I think I clicked it wrong. There you go. Next is eating and drinking. If the patient has any problems with eating and drinking, most especially if the patient has problems with swallowing, you will be seeing it at the section. So we all know that swallowing, problems with swallowing, or we also know it as dysphagia. So in the UK, if your patient has problems with swallowing, definitely do not attempt to feed the patient. Normally, if you're trained to do a nurse-led swallow, you can perform it. If not, you can ask your colleague, or the most important thing that you have to do is to refer the patient to the SALT. So SALT is the speech and language therapist. Next is personal hygiene. Of course, that's self-explanatory. Elimination. So elimination, it's one of the important part and of the admission booklet. Why? It talks about if the patient has problems with urination, or if the patient has problems with their bowel movement, if they're constipated, or if they have any loose bowel movement. That information will be placed on this section of the document. So why is it important? Because it may be part of your conversation. There are scenarios on the examination wherein this is very much important. Okay? Most especially if you're doing the A2E assessment, elimination is an integral part of that. Next is urinalysis. So urinalysis, I think we're nearly done with the pages of this document. So urinalysis on the examination, you might be seeing a urine specimen on the patient's desk lying. So the most important thing that you need to remember in terms of this is to give the patient instruction in how to collect urine. On the urinalysis section, there's like a table there. If it's blank, make sure to give the patient instruction to collect the urine. So most of the time, it's already accomplished. So why is it here? Because it's part of the admission. Okay, it's part of the admission. Next is breathing. So definitely breathing. This one is really important if your scenario is all about asthma or pneumonia. Okay, so you'll be seeing that information on this section. Sleeping, there are scenarios wherein the patient has problems with sleeping. And there's also a particular scenario which talks about death and dying. So make sure you practice your communication skills. Why? Because you might encounter a patient who is afraid of death and dying. Okay? It's not our normal conversation. You don't talk to people every day who's like afraid of dying, isn't it? So, but you might encounter that in the examination. The most important thing that you have to remember is to develop your communication skills. So try to think about this. So what are you going to say to a person who is afraid of death and dying? What if I ask you, oh nurse, will I die? What will be your response? Okay, so think about that. It's your task, okay? So there is no right or wrong question. But then again, the most important thing is to show compassion. And pain, so pain. So make sure you ask the patient if the patient is in pain, all right? So whenever you ask the patient for presence of pain, you always remember the scoring system. So 0, no pain, and then 10, the highest possible pain. And of course, as a follow-up question, you could also ask where the pain is and the quality of the pain, all right? So always remember that. You don't have to perform. I know you've seen the video, or probably you've seen or you've heard about the PQRST. You don't have to ask everything because again, you only have 50 minutes to perform that. But those are the most important questions. If you're in pain, if the patient is in pain, the score, the quality, and the location. So that should be fine, okay? Because for the new test of competence, pain is a standalone station, okay? It's a standalone station. And lastly, it's working and playing. It's about the patient's job and hobbies. Probably the question is, Emmer, do we need to write anything in this document? The answer is no. So this document on the examination, it's laminated. So you cannot write anything on this document. In the examination, this document has been completed by the previous shift or the previous nurse prior to handing over to your care, okay? So if there are any information missing on this document in particular, you don't have to ask the patient, okay? That's why you're assessing the patient to gather more information, yeah? And you only need to focus on areas wherein you think it will matter the most to the patient, okay? So as your conversation unravel with the patient, you will know what are the most important aspect of care the patient needs. Yeah. So hopefully that is that information is useful. I think some of you are probably waiting for the new test of competence. Yeah. So this one, last document, I think this is the last. The last document for the old test of competence is what we call the discharge letter. So this one is more straightforward as compared to the other one. So this document is applicable in the community. If you're having a community scenario, this will be the document. So this is what we call the discharge care letter. So this one is pretty easy. So it contains the patient's details, the reason for admission, the primary diagnosis, the actual or potential care needs identified, the nursing medical interventions, the past medical history, medications, allergies, social history, and the discharge summary. I'll give you a tip for this document. So can you see the medication part? So take note of that because most likely you will see these medications again once you go to implementation station. Okay, so that is one of my tips when reading the discharge letter. So Emmer, how will we know what document are we dealing with an examination? This information will be given, these documents will be handed to you by the assessor. So if you're seeing this, that means the scenario is in the community. If you're seeing the other one, the admission booklet, that means you are in the hospital. Okay, so that is that. You don't have to select. Okay, you don't have to select. It will be all provided for you on the examination, but you cannot see both. Okay, you cannot see both.